for singing, it would be good.
I'm from Environmental Services and I've been here 25 years.
Maintenance supervisor and I've been here 23 years.
Construction manager and I've been here 24 years.
I've been here for 43 years. I'm one of the managers of the operating room and I've been here for 26 years.
I was hired by Sister Sheila in 1982.
I've volunteered at Mercy Hospital for over 30 years.
Well, I'd like to welcome you all to today's blessing and dedication of the Heritage Corridor. I'd especially like to welcome the Sisters of Mercy, all of our associates, our volunteers, even some of our neighbors have stopped by, and Friends of Mercy. We could not have done this project without the support of the Catholic health system. The Catholic health system believes in our journey, believes that mercy can be great, believes that we can be more than we have been and build on the great work of people that have come before us. Our values of reverence, compassion, justice, and excellence, that's what mercy is.
If you think about it, when a person visits the home of a friend, it is obvious who and what is important to that friend by looking at the photos that are hanging on the wall or sitting on a table. So when a person enters Mercy Hospital and sees this Heritage Corridor, it will be a very clear indication of the value and esteem in which the Sisters of Mercy are held.
So in the emergency center, if you remember, we wanted to display the values of the Catholic health system, our heritage, being founded by the Sisters of Mercy, and then the history of Mercy Hospital. So we have the values over there. We have Catherine McCauley's picture there, the history of the Sisters of Mercy, and the third piece was the history of Mercy Hospital, which is being unveiled today. The first panel, it reminds us that although our facade has changed, the Mercy legacy continues in the countless numbers of Sisters of Mercy, employees, medical staff who've served here through all these years. The second panel talks a little bit about the history of Mercy Hospital and its richness.
Many of these pictures are going to be familiar to you, but I just say this. The Sisters of Mercy consider themselves the foundation of Mercy Hospital. But we challenge and look to you, everyone who's an associate here, or a volunteer here, or a visitor here, to carry on the work of mercy, because it isn't just our job, it's your job as well. Thank you.
The next panel represents the building changes throughout the years. From our first house on Tiff Street, all the way down to the end, to our new emergency center. This panel clearly displays the difference in patient care by depicting the operating room on Tiff Street to an operating room in 2011. This displays a timeline of major events for Mercy Hospital, from the very beginnings on Tiff Street through interior and exterior changes and significant events for the past 106 years. This panel shows our diligent and dedicated employees working in many areas with the modern equipment of the day. This panel honors our nurses and all that they have done and continue to do to make Mercy Hospital a place of comfort and compassion. This panel represents the commitment of our physicians in teaching new doctors how to best care for their patients.
You are a God of love and tenderness. I put my faith in you, and I ask that you grant me acceptance of your plan. Oh,